So first time using your whitening agent, your syringe comes like this. So you pop on the little application lid and take off the tip and pop out a little bit of gel onto a tissue. So you're just squeezing it very gently, because sometimes there's air bubbles in the syringes, so you don't want it going all over the place. So just put a little bit out on a tissue like that, just to have before you start. So just for the purposes of video, I'm going to use this purple gel just so you can see what I'm doing, because you're only putting a very small drop into each individual tooth on your whitening trays. So the bottom teeth are going to, you're putting it down over the teeth. So we're going to put it on the top part of the bottom teeth. Okay, it doesn't have to be very exact, but what it does need is a very small amount. More doesn't mean you'll get a better result. Just a little drop in each tooth, about the first kind of 6 or 8 teeth, depending on your smile, and then you just pop that down over your teeth so that it spills down and spreads around the teeth like that. Okay, then when you're doing the top teeth, you're going to pop it into the middle part of the teeth so that it spreads around each tooth when you pop them in. So it's essentially going to spread the whole way around the tooth when you put it into your mouth. Okay, and you're doing that in between or on each tooth, right back to possibly the premolars, even the second premolars, if dependent on your smile. It's not necessary to put it onto the molar teeth because you don't see them. So when you're finished, applications about 2 hours to overnight. So when you're finished with it, you take them out, rinse them off. You can use your toothbrush to clean it off if you want. Cold water, not warm, and leave them upside down to dry so that they're fully dry. If they're wet, the whitening agent won't apply the next time. It's too hard. So if you have to dry them, use a cold setting on your hairdryer to dry it off if needs be. But if you're drying them out for a few hours, upside down is perfect. Now, if you can see here where I've left the syringe, some of the gel has expressed out of the syringe. So when you're finished, make sure you pull back the syringe and then put the lid on, so that for the next application then you don't have it all over the place. But then when you're going to do it again, it's a tiny bit out onto a tissue so that you can kind of get started. So applications wise, you're doing anything up to 14 applications. You can spread that out over, you can do once a week or twice a week or 3 times a week. Just depends on yourself. Anywhere between a month and 6 weeks will work. Any sensitivity during that time, you can remind her to use your Sensodyne toothpaste.